Let's transition to fall prevention. I know that as older adults age, falls are quite common and really one of the biggest things that tend to lead to needing assistance or other issues, hip, legs, knees, that sort of thing. And so we really want to prevent falls as much as possible for good health. So how can cataract surgery help with this?
As you mentioned, falls are a significant public health problem among older people worldwide. They represent the second cause of death by non-intentional injuries. And I found in one study that showed it was like 646,000 deaths by falls occurring annually. So when I see a patient who is hesitant on cataract surgery, but they use a wheelchair, they use a cane, they're having trouble walking, I will say, hey, you might want to think about cataract surgery because it should help to decrease your risk of falling. And I did find one study in 2021 in the Journal of Ophthalmology that found evidence that first eye cataract surgery can reduce the risk of falls in older Americans. But second eye cataract surgery may not have additional significant impact. But it makes intuitive sense to us, right? That if you have cataracts, and also there are gradations of cataracts, right? So what I find also fascinating is as a patient gets cataracts, their mood changes. Their risk of depression changes. Monet, if you trace his paintings over time, they change in color because of his cataracts.
Oh, no kidding.
So it's interesting to follow artists over time. Certainly in terms of long-term care, one of the biggest risk factors, I find Alzheimer's. One of the greatest opportunities we have as ophthalmologists to help patients lead healthier lives is to consider patients who have early Alzheimer's, middle Alzheimer's. They can be depressed, or families may say, we don't want to do surgery because they already have Alzheimer's. But if they can't see their food, if they can't watch the TV, if they can't do what they're enjoying doing, that can lead to increased signs of depression. I have anecdotally had great response with cataract surgery where patients are able to lead healthier lives. And I think that that's been the great joy of being an ophthalmologist.
Oh, I believe that. Yeah. If you're not seeing life, if you're not being able to experience what you typically have been able to experience, right, in the decade before now, you're probably not going to be as happy and content. So we want to improve that as much as possible, not just physically, but for the mental health as well. So thanks for sharing that.